Welcome to another program of Health Matters, a presentation by the Ministry of Health. I am Nazim Hussain, and on today's program, we'll be talking about HIV and AIDS, World AIDS Day, December 1, 2025. We're going to be finding out about the works of the National AIDS Program here at the Ministry of Health. I've got with me Dr. Keisha. She is the National STI Program Coordinator attached to the National AIDS Program Secretariat. Hello there, Dr. Chin. Welcome to our program. Tell us a bit about, first of all, the theme this year. And interestingly, Guyana and the Ministry of Health has its own theme this year.
Thank you very much for having me today, Mr. Hussain. So the International UNAIDS team is actually overcoming disruption, transforming the AIDS response. And we see it as that international team rather, we see it as a renewed call for accelerated momentum towards the HIV response and working towards elimination of HIV/AIDS as a public health threat by the year 2030. However, this year, the Ministry of Health through the National AIDS Program Secretariat would have decided to do things a little bit better, not better, but a little bit different rather. And it's still in keeping with the international team. So our team for this year through the National AIDS Program Secretariat is actually Communities Leading Equity in Action. So as I would have said, it's in keeping with the international team, but also we thought it best to personalize it a bit to see how, as a national program responsible for that response, how we can engage our parties, engage our stakeholders, engage persons on the ground to see how best we can, personalize our response, see how we can, make our own call to action to how best we can tailor the responses that we have to the work that we're doing here in Guyana.
You mentioned, the eradication of HIV and AIDS by 2030, and that's going to be a challenging pathway. 2025, it's now coming to an end. What has 2025 brought as it leads to that pathway?
So where we are currently in terms of achieving our UNAIDS target, as it is, we want to look at some key areas. We want to look at what we're doing under the prevention arm of the national program and also what we're doing under the care, treatment, and support arm of our national program. So some things that we have done so far would be to expand and optimize services that we're offering as combination prevention. So what is combination prevention? Some of the elements included in that would be for us to expand testing services. So we've expanded the number of sites where persons can go and get tested for HIV and other forms of sexually transmitted infections. And just to stick on that point a little bit, we've tried to make the service as comprehensive as possible. So when you go to a particular testing site and the number of testing sites now that we have, you can get tested for HIV, you can get tested for syphilis, hepatitis B, hepatitis C. And at quite a number of our sites also, we're offering swabbing tests, rapid testing for gonorrhea and chlamydia as well. So we've really optimized the testing. We try to make it, as I said, a complete package that we're offering to persons to optimize on that opportunity when a person makes up their mind to go and get tested at a particular facility. Under testing as well, we've continued to go into multiple communities, whether they're communities where we're seeing that those particular communities are key hotspots, or communities where services can be optimized, meaning services can be, be better or accelerated in those communities, or where there's a general need or a call to us is placed and said, well, in this particular community or at this particular facility or institution, we would like for you guys to engage us and come and offer the testing services that we have. We've also expanded and optimized the commodities that we're offering persons. So I think everybody is quite au fait with us having free distribution and making available and accessible condoms and lubricants. We've continued to offer that, but we've branded them a little bit different. We've been doing it since last year, where we have, and I'm pretty sure we'll talk about it a little later on, where we have our Prep for Sex bags, where you can have quite a number of commodities included within that Prep for Sex bag, including our HIV self-testing kit. We've continued to go into, as I said before, institutions. We've expanded services. And then on the care, treatment, and support arm, we've expanded the number of sites that are offering care, treatment, and support, not only at the private level, but also, of course, within the public level. We are looking to also expand at quite all of the new regional hospitals that have been established. So that's what we're doing at the National AIDS Program Secretariat.
Quite, a lot of work there, just to capture that in a nutshell. But of course, a whole year's of work, is really can't capture in a program like this. One of the other aspects of the work done at NAPS is how do you, I'm quite sure you do, train the necessary workers, doctors, social workers, care and treatment officials, and persons who are doing testing also.
Yes, so capacity building is something that we've always advocated for and we've taken seriously at NAPS. So throughout the years, and it's in keeping with what we would have been doing in previous years as well, we've been offering continuing medical education sessions, commonly referred to as CMEs. We've been including the different cadres of healthcare workers in those educational sessions. So not only clinicians or doctors, but we've included nurses, we've included social workers, we've included persons that fall under the umbrella of allied health, like our counselor testers, to ensure that everybody is sensitized on what is HIV, they're sensitized on the other common sexually transmitted infections that we have present in Guyana. We train persons on updated treatment guidelines under our combination prevention arm, what services are available in Guyana, where they're available, how accessible they are. And it's to really bring our healthcare standards here in Guyana to where it should be in keeping with international standards, to ensure that in any facility, any public facility one of our citizens would visit, to have either testing services or care, treatment, and support services. It's the highest quality of service that we can offer here in Guyana.
Right, we're talking to Dr. Keisha Chin from the National AIDS Program Secretariat as Guyana joined the rest of the world in observing World AIDS Day 2025. Stay with us, we'll be right back.
Hello, I am Dr. Tariq Jagnarang, Program Manager of the National AIDS Program Secretariat, Guyana. HIV self-testing makes it easier for you to know your HIV status. It's better to know because early treatment makes a difference if you test positive. Living with HIV is not only possible, it is now made easier by the availability of HIV self-testing kits in Guyana. HIV is no longer life-threatening, it is life-changing. You can get a free HIV self-testing kit from the National AIDS Program Secretariat on Hatfield Street, Georgetown, or at any one of our voluntary counseling and testing sites countrywide.
This PSA was made possible through a partnership between Guyana and the American people through PEPFAR.
Welcome back to our program. On World AIDS Day, the National AIDS Program would normally have one or more signature events, and one of those activities to commemorate World AIDS Day this year is a conference. Dr. Chin, tell us a bit about this conference.
So every year, as you said, we try to engage various categories of workers, whether they're healthcare workers, persons from the private sector, or even persons from our NGOs and partnering CSOs. So this year, one of the activities that we have, which is one of our signature activities, is actually the Workplace Policy Conference. And we're hosting that particular conference and having participants, and we're doing it in collaboration with the Ministry of Labor. And it's really to make persons either from the public or the private sector aware, as I said, of what is HIV, what are the STIs, and how educate them on how stigma and discrimination affects persons within the workplace, and how best we can, nurture attitudes that are more welcoming and that are more, understanding of persons who are living with HIV, or even persons that may not be living, but persons that are affected by HIV in the workplace.
And that's almost, you hit a very important aspect there about stigma and discrimination, and that's almost become almost sub-program within the National AIDS program to deal a lot with, 37 years in this country. The first case came in 1987, and still we're still grappling with stigma and self-stigma. How important it is to continue this, to sensitize not only people in the workplace, but all Guyanese as to what stigma discrimination can do to someone who's living with HIV and AIDS, and especially if they're on treatment.
Okay, so the thing about it is that, stigma and discrimination, as you mentioned, has been around from the beginning, since we've had our first documented or known case. And the thing about it is that we have made great progress throughout the years in addressing stigma and discrimination, not only within the public or private sector, but also even within the healthcare sector. We've taken steps to educate even healthcare workers, and then we sort of try to branch off to include other categories of healthcare workers. So the thing about it is that we need to understand the importance of addressing stigma and discrimination as a national program, because S&D, as it's commonly referred to, it affects not only the treatment of persons that are living with HIV, but it also affects their family members, where you can see persons that are living with HIV because of stigma and discrimination. They're not going to disclose to their family members, then there's not that social support that is necessary for persons that are living with HIV to ensure that they are adherent or taking their treatment as necessary. They'll be afraid, they'll be hiding their medications, they'll feel some sort of way in terms of them visiting their health centers or their healthcare providers to receive their treatment. They're hiding, they don't want persons to know that they're going to a clinic with even a hint of, what are you going to that particular clinic for? We know who normally goes to that clinic. And also it can extend beyond care, treatment, and support. It can even be extended towards our testing arm of the program, our preventative arm, where persons feel some sort of stigma, discrimination in seeking preventative services, like coming for testing for HIV or some other form of sexually transmitted infections. They may feel some sort of way are judged by society in collecting the free condoms that we have accessible and available, and other commodities like our lubricants, our HIV self-testing kit, or even our IEC materials, our information, education, and communication materials, rather, because they just think that persons are judging them. And we really try to address the community, address the workplace, and even within the healthcare sector to ensure that persons are educated so that they can adopt better attitudes towards persons that are either living or affected by HIV.
Before the break, we spoke about the various places, especially in the public sector, that the National AIDS Program, Ministry of Health, is working with HIV/AIDS prevention, care, and treatment. But the NAPS also is working with some private sector health facilities.
Well, we have, so let's say, for example, we have quite a few health facilities that offer care, treatment, and support. A few that I can mention off the top, we have Davis Memorial Hospital, we have True Mercy Hospital, and we also have some other healthcare providers that have smaller clinics that are associated with those hospitals that do offer care, treatment, and support. But the thing about it, on speaking about our work that we're doing with the private sector, it's that we recognize that some persons may want to, for their own personal reasons, not seek services at the public institutions. They're available, they're accessible, they're always there, but we want to ensure that services available and accessible wherever our clients feel comfortable going. So there are a list of services, or a list of facilities rather, that offer those services, whether it's testing or care, treatment, and support. And if they're interested in seeing a site that is either closest to them or most convenient to them, they can visit our Facebook page, and we have all of those sites listed.
You mentioned the Facebook page, and of course NAPS is already doing a lot of work in social media. But on that Facebook page, you can see one of, you want to call it, one of the NAPS outstanding product, that bag. Tell us about that, and especially the two main features in that bag.
Okay, so it's officially referred to as our Prep for Sex bag, but in the community, persons refer to it as a lash bag, actually. And what that bag is, it actually falls under our combination prevention services that we're offering. So as I mentioned before, persons are accustomed to having made freely available to them condoms, lubricants, and our IEC materials, which is our pamphlets or our brochures. So we've decided that when persons come, we want to package that in such a way that it's attractive to the client, but it's also offering them all the commodities that are necessary for them to protect themselves and to prevent the acquisition of HIV, other STIs, and for them to educate themselves as well. So within that bag, few of the elements that you can find commonly placed within that Prep for Sex bag, we can have our HIV self-testing kit, which is a kit that we also provide freely, and it tests for HIV, and you can have that test done in the privacy and convenience and within the convenience of your own home. You can also find condoms, different colored condoms, different scented condoms, sometimes condoms of various sizes as well. You can also find our lubricants, either the standard water-based lubricant, or you can have the orange flavored lubricants. You can find pamphlets, you can find brochures. And there are certain versions of that bag depending on where you seek services to get that Prep for Sex bag. We can even include a supply of our PrEP, which is pre-exposure prophylaxis for HIV acquisition medication inside.
Let's focus a bit on that. That's self-testing. You get one of those self-tests. You're home. You get a test sometime which can be positive. What's the next stage?
So according to our national algorithm here in Ghana, we've been using and we have to continue to reference that no matter what type of HIV test you're doing, is that nobody is really diagnosed as living with HIV or HIV positive with one single test. So the thing that I want persons to understand with a self-testing kit is that first, it's extremely accurate. It is just as accurate as the finger prick or the blood drawn test that you're doing. So if you're at home and you do the oral swab because it utilizes saliva, you place it in the bottle with a reagent, and it's similar to a pregnancy test. If you see one line in the C or control window, it means that your test was performed effectively and that you have a negative. So there's no need for you to go and confirm your negative results. So if you're home and you see one line in the control window, a negative is a negative and that is your result. However, if you see two lines, which is one in the control window and then a second line in the testing window, that is a preliminary result, and we refer to it as a reactive test kit, meaning that if you were to observe that after performing your oral swab, you need to visit one of our testing facilities to have a confirmation test done for you. Now, to add a little bit further to that, if when you visit a health facility and your second confirmation test is done, and let's say, for example, it gives you a negative, we then go to a third and final test, which is referred to as our tiebreaker. And whatever the results are of that, that is your final result.
You mentioned about the prevention, condoms, and from day one, it was always condoms. And recently, because of development in the health sector, and we've got PrEP, a medication. Tell us about that and how does that work, especially when it comes to the protocols and guidelines of National AIDS Program Secretariat.
Okay, so as I said, as part of our combination prevention services that we're offering, we still continue to offer condoms. Condoms are still there. However, we've added, within the last few years, our PrEP, which stands for pre-exposure prophylaxis. And it's pre-exposure prophylaxis against HIV acquisition, meaning that when a person visits a health facility, and if either through clinical consultation or based on what they are referring and they know of their sexual lifestyle and their practices, they're deemed to be at substantial risk for HIV acquisition, meaning that there's something that they're either doing or there's something that they're exposed to based on their sexual lifestyle and habit that puts them at high risk for HIV, for contracting HIV acquisition. They can be evaluated. Firstly, we would test them to ensure that they aren't already living with HIV. And if that test is negative, we can then offer them PrEP, as I said, which stands for pre-exposure prophylaxis. And it's a pill that you can take. And once you take that pill correctly as prescribed by your clinician, it prevents you from contracting HIV. It's highly effective. It's about 98 to 99% effective if you use it as prescribed. And for the years that we've been offering it here in Guyana, we've not had a case where someone was using it correctly and seroconverted, meaning that they were not using it correctly and still contracted HIV. So I don't want, it's, as I said, it's a service, it's a commodity that's being offered. We have lots of persons in Guyana that are already utilizing or they're on continuous PrEP, meaning that they feel that because of whatever they're exposed to or whatever they're doing, they need to continue to take the PrEP medication in order to protect themselves. And I stress on that point, continuous, because I don't want persons to go away with the idea that PrEP is a for life medication. You can take it as long as there is a risk of you acquiring HIV. And then when that risk no longer exists, you can be safely discontinued from the PrEP medication. And also I want persons to know that it's just an additional layer. PrEP prevents you from contracting HIV, but it does not prevent the other forms of sexually transmitted infections. So in quite a few cases, you have persons that are on PrEP, but they also continue to use condoms as necessary.
We're continuing our program of Health Matters, and we're talking to Dr. Keisha Chin as we observe World AIDS Day 2025. Stay with us. We have more for you.
So when you're having fun, don't forget condom.
Stigma and discrimination to people living with HIV hurts. The person living with HIV deserves respect, tolerance, inclusion, and support like any other person. If your beliefs or attitude cause you to scorn or fear a person living with HIV, speak with that loved one or a professional today. Caring for those living with HIV does you no harm. Learn the facts. HIV is life-changing, but with treatment, not life-threatening.
A message from the Ministry of Health and the National AIDS Program Secretariat with support from Global Fund.
Welcome back to our program. We spoke about the self-tests or any testing, and someone will be tested HIV positive. There's a confirmation. What next? What happens? How does one, navigate to a treatment site?
So what we've tried to do, at least within the last few years, is try to have our services, as I said, be as comprehensive as possible. So although it's not 100% currently, what we have tried to do is to make all of our testing sites care and treatment sites as well, so that there's not a need for a person to move from one particular facility where they would have been tested, receive their series, or according to our national algorithm, confirmed to be living with HIV, to then have to go to another facility or institution to receive services. So once a person is confirmed to be living with HIV, they are immediately, to the best of our abilities, they are immediately navigated into care and treatment services, where another maybe battery of tests is done for them. We can take baseline testing. We can sensitize them on what HIV is to ensure that they comprehend fully about their status, what is expected of them in terms of them taking their treatment. We try to start them on treatment, if not the same day, as soon as possible, because there are situations in which persons need a little bit of time to process. But even in the cases where persons delay treatment for a short period of time, we try to tell them how best they can protect themselves against contracting any other form of STI, or how best they can, curb their lifestyle and their practices to not infect anyone else if they have any other sexual partners. Once a person is navigated into care, treatment, and support, they're under treatment. We try to advocate for proper adherence or high adherence to treatment, meaning you're supposed to take your medication as prescribed, take it every day, attend your clinic, ensure that you meet with your clinicians intermittently or at whatever frequency has been indicated to you. Try not to miss any clinics. If we have situations where persons are not coming to clinic, we have a program where we actively try to engage those persons to see what barriers, hindrances, what difficulties they may be experiencing that prevents them from accessing care and treatment services. And also we try to offer support in terms of nutritional support that we give to our patients. So at the National AIDS Program Secretariat, we also have our food bank where they can receive a hamper at particular periods, and these hampers are within the hampers it contains nutritional products that can help them trying to cover all the food groups to ensure that not only are they in treatment, but also that they are their nutrition is of a high standard.
Right, because
well.
the medication is
Correct.
You you have to be on a proper diet for your intake of medication.
So the thing about it is that with the medication that we have, the side effects are very limited. However, them having proper nutrition and a proper diet supports the work that the medication is doing, and it also helps them in terms of their clinical presentation to ensure that they are able to fight off any other diseases that may become present. So I think, as I said, it's as comprehensive as we can get. Of course, there's always room for improvement, but as it is currently, I'm very proud to say that the services that we're offering at the National AIDS Program Secretariat, it's one of the best in the Caribbean.
With the new regional hospitals in the making, will we see some of those regional hospitals come on board with care and treatment and support?
We are always looking to expand services, and there are quite a few new regional hospitals that have been commissioned recently, and I can safely say for sure that at the Enmore Hospital and also at number 75 Hospital in Region 6, we've already fully incorporated HIV, not only testing, but care, treatment, and support services at those hospitals. And we've already engaged other hospitals that have been commissioned to see how best we can work with the administration of those hospitals to see how best we can offer services as soon as possible.
What about the remote areas? Do we cater for those people in remote areas?
So in the hinterland regions, we have either specific clinics, or we have at the hospitals within those hinterland regions where we're constantly not only offering testing services, but we're also offering care, treatment, and support services. And we also have from time to time persons that move centrally that go into those areas that the regions may either have some sort of difficulty, or because of the workload that they're having within those regions, they may not be able to visit certain, secluded areas or far to reach areas at a particular frequency. So we work closely with the region. We've always advocated for regional ownership of their HIV program to see how best as a region you can address the concerns of your residents, of your citizens within those regions. But of course, with full support from us centrally here through the National AIDS Program Secretariat.
What's going to be the plan for the new year?
So for the new year, we're simply looking to expand services, not only treatment services, expand testing services. We're looking to go into continue our work in going into private facilities. We're looking to continue our work in educating the new healthcare workers that are being placed into the system. We are looking to work closely with the regions to see how best from centrally we can continue to optimize and expand the services that the regions are offering, and also to know that also to work to ensure that the general public is aware of what we're doing as a national program to address HIV, other forms of STIs, to ensure that products and commodities, especially the preventative products and commodities, are fully accessible and available. Persons are aware of what is being offered by the National AIDS Program Secretariat, where they can access it, and to ensure that we work towards eliminating HIV and other STIs as a public health threat here in Guyana.
Very quickly, because I don't think we talked about it. One thing the NAPS was or is noted for, it's field work, or sometimes at night, sometimes you find them at various parks and so forth. Those field work will still continue going to the people?
Yes, we're constantly in the habit of going into the communities, taking the services and the products to the community. And even as part of our upcoming World AIDS Day commemorations, we have quite a few communities that have been earmarked as part of our, commemoration to bring services, or take rather services to those communities, ensure that testing can be done, ensure that products are available and accessible within those communities, and persons can visit the National AIDS Program Secretariat. Our Facebook page is a very vibrant page, and persons can visit there to see, which communities we'll be headed into next.
Thank you very much, Dr. Chin. This has been Health Matters, as we talked to the National AIDS Program Secretariat about World AIDS Day 2025. I'm Nazim Hussain, thanking you for being with us on the program. Do join us again next time. Until that time, stay well.